Hi, I'm Dr. Justin Mims, and we're watching a veterinary teaching moment.
Here's our patient Bruno, and he's in for a minor procedure today where we're going to collect some fluid from his trachea to help diagnose his chronic pneumonia that he wound up with after potentially aspirating during a vomiting episode. Here we are prepping the leg for an IV catheter. And this is so we can administer medication, put him under anesthesia briefly while we do this minor procedure. And here we are taping the catheter in, clean up some of the blood around it. And here we are still taping the catheter in. And we're taping the catheter in still. I think one more piece of tape. That may have been the final piece. No, this may be the final piece. Or was that the final piece? The catheter is taped in now. Here we are flushing the catheter to make sure that it is patent and it's in the vein, especially after we secured it with so much tape. Here we're prepping the table. This is a sterile drape. We're dropping all the supplies that we'll need through the procedure in a sterile and sanitary fashion. Any of the fluids, the best that we can. And here we are using a sterile endotracheal tube, and I'm placing sterile gloves, collecting sterile saline to use for the Trans-Tracheal Wash. And here we are, Haley is inducing the patient with propofol. And this is just so we can intubate him and do this procedure comfortably. And here I am placing the endotracheal tube. The endotracheal tube is going to be a pathway for another smaller catheter that we're going to run down the center of the tube into the trachea. And then we're going to try to collect some mucus from the trachea. And here we are instilling the saline, and you can see the bubbles and even some of the mucus coming back with the first aspirate. So this was a very productive trans-tracheal wash. Sometimes you put in all of this fluid and you don't necessarily get back something with this kind of viscosity. And we'll position the head, raise and lower the head to where, we can try to find some of that fluid that may be pooling with the mucus that's in the airway. And so raising and lowering the head, changes the position of the trachea and allows us to, potentially find those pools. And we're trying to collect as large of a sample as possible so that we can split this up to send out for 3 separate tests. We're going to do a bacterial culture and sensitivity, and that'll let us know what bacteria may be growing in his airways. The sensitivity part of that will let us know what antibiotics are going to be effective against the organisms, if we do grow any organisms. The fungal culture will let us know if there are any fungal elements or if there's a fungal aspect to this pneumonia. And then the cytology will let us know if we potentially have any parasitic involvement. It'll let us know what type of inflammatory cells we have present, and also let us know if we have any other cells, abnormal cells present, potentially like cancer or something that could indicate that we could potentially have a foreign object in the airway. And it could also let us know if we're dealing with, an inflammatory condition of the lungs as well. And here we are after we've completed the procedure, replacing more oxygen just to make sure he's completely oxygenated while he's recovering, helping ventilate him some by giving him a few deep breaths, kind of helping him sigh. And as he's beginning to wake up, they'll start swallowing. Sometimes they may start moving their mouth. They'll be taking deep breaths. Since we did instill some additional fluid into his airway, he may cough a little bit more than the typical recovery, but this is a normal response during recovery. The tube, they kind of feel the presence of the tube and will start swallowing and then coughing in order to help move the tube. And as you can see, there's a ton of mucus still in his airway, and this is all just secondary to the pneumonia that he's had over the past few weeks. And here we are, we're just placing the samples into vials so that we can place it into a centrifuge and spin it down so that we can collect kind of a concentrated part of this sample. But you can see the kind of stringy mucus material within the saline. And then here, this is always really cool as it all moves together as one unit, aka the goober.
But did you see how the whole like goober was stuck together and went inside of there? See what's on the bottom, but that's what we're going to culture, is what's spun down to the bottom. Oh yeah, that one. There's a lot.
Yes, please.